able to take care of a child, you should at least be familiar with the child. You should know the child, try to be friendly with the child, because children will normally not give information or confide in somebody that they are not used to or they are not familiar with. So if for you to take care of a child, you should be familiar with the child, at least, if not being a relative or friends or being colleagues with the parents. You should at least have had contacts, talk, and some communication with the child for you to be able to understand the child and take care of the child. So it's not necessarily parents or family, friends, or colleagues that can take care of children. So once you are familiar with a child and you are able to relate with the child to the extent that he can confide in you, then you will be able to offer help and take care of a child. For a child not to open up to the parent, that means the parent is not always there, or is not friendly with the child, or is not patient enough with the child. And so if the child will find a teacher or a friend that will give him or her a listening ear, that will not be judgmental, that will be patient enough, and the friend considers that elder or that adult, that teacher, as a friend, then the child can easily open up to the elder or family friend to confide in the adult. It's not supposed to be the ideal situation, because it's supposed to be there's supposed to be a close relationship between a child and the parent, because you are the ones that stay with the child more, he sleeps, he eats, you feed, you clean, you take care of the child. Then the relationship, the child should be closer to his or her parents than those outside, because how many hours will a child spend in school or when the child goes out to play and all that? It shows that at home the child is not having enough attention. If the child will open up to friends or teachers in school and not open up to the parents. So I think that means the parents will need to work on their relationship with the child so that the child can open up to them. It just shows that there is a dysfunction happening at home if a child cannot open up to his parents. A parent abandoning a child that is sick, that has sickle cell anemia, that is really a form of child abuse. That's child abuse, because you as an adult, you're supposed to take responsibility. A child needs care, a child needs to be looked after. And so if you as an adult is giving up that because the child has sickle cell anemia, which is not the fault of the child. How do one get sickle cell anemia? It's an inherited disease. It's gotten from if the mother has AS and then the father too, the blood genotype is AS, then there is a chance of them having a child that has sickle cell anemia. But that's not the end of the world. Having a child with sickle cell anemia just means that, okay, you will need to pay more attention to this child and take care of the child. For you to abandon such a child that needs more care than even the other children that are not sick, then that is gross wickedness. That is a form of child abuse. If it is in countries where things work, those parents will have to face the law, because that child needs a lot of care. If he's abandoned, that means his medications, giving him all his routine immunizations that is going to prevent him from falling ill and give him the added immunity that he needs will not be there. All the care he needs, he needs more care than even kids that are not with sickle cell anemia. So that child will be exposed to a lot of crises, both health-wise, physically, psychologically, emotionally, and that will really not be good for that child. I don't think a child with sickle cell anemia that is abandoned will survive, because they need more care. And all the hospital visits for checkups that the child needs, the drugs that the child needs daily, who is going to provide for the child if not the parent? So a child with sickle cell anemia should not be abandoned, because that will spell doom for that child.
I have sickle cell, but I'm not a sickler. An individual like me is not stigma. A perplexing circumstance of my enigma has me friends stereotyping and not understanding. Family empathizing but not contributing. Ladies admiring but not loving. Engaging but not indulging. I have a condition, but who doesn't? It may be malaria, typhoid, or hepatitis. I keep defending I am not a disease, but human. Also endowed with genes and DNA, bone marrow, genotype and blood type, veins and bones, heartbeat and brainstorm. I've got a life and I'm living it. Except I'm dead, I'm as human as any other, carrying my cross lighter than that of others caught up between life and death, yet seen as a human defect. I may not be an athlete or bodybuilder, but I can be a doctor, scientist and an artist, fulfilling my own purpose. I am sickle, not cursed. Neither am I a walking corpse. And until I am dead, I live with my condition because I am as human as any other. Just human.
I have sickle cell disease, but I'm not a sickler. I am a lady, not a walking corpse. I am a girl, a lover, not a pandemic. Guys at Mariam, but not approaching. Crushing, but not toasting. Lost in my vulnerability, following my friendship. I am a woman, not a spirit. I am a mother, a wife, and a guardian, not a pawn. I am human enough to overcome the stigma of my stereotype. I have a lot to offer because I'm not a weakness. I am reproductive enough to offspring greatness with enough breast milk for nurture. I can be a lawyer, architect, or a scientist. I am a friend, a girlfriend, a lover, a companion. Beautiful, pretty, or whatever. Going places, overseas, or wherever. Until I am dead, I live with my condition, because I am as human as any other. Just human.
Children with sickle cell anemia needs a lot of care and understanding. So, especially for an adolescent, even if the child is not a sickle cell anemia patient, you don't correct or instruct or train a child by just beating the child. That will actually be another form of child abuse, physical abuse. If a child has sickle cell anemia and just because the child is not willing to do house chores or one thing or the other, you should, it should be a kind of communication between the mother and the child, trying to find out what is the reason why the child is not doing this, and giving rewards, encouragement. Then that will help the child, to do what she's supposed to do. But when you use the rod, I know the Bible says when you spare the rod, you will spoil the child. But it's not on all occasions, especially for an adolescent. You should be able to communicate. You should understand that a lot of things trigger sickle cell, their crisis. So, for example, apart from infections, apart from them not taking their medications, apart from heat, cold, things like stress, a lot of stress, whether it's emotional, whether it's physical, whether it's psychological, triggers their crisis. So if the mother keeps on beating the child, then that child is going to be falling into crisis always, and that will not be good for the child, the health of the child. The mother at the end of the day will spend more instead of just taking time to explain to the child and trying to encourage the child to do, even if it's not every day that the child will be willing to go to the farm. At least you can come to an agreement and say, okay, maybe the child can go to the farm once a week and I will give you this. Do a kind of reward system. It should not be autocratic. It should not be forceful, and certainly not by beating. I've said this before, as adults, we have to take responsibility. These are children, and as they don't have the ability to take care of themselves. So you don't tell a child to go look for money to buy drugs. That means you're exposing the child to either, if it's a girl, the girl can now, do other things like move with men, trying to get money to fend for herself, and that's not supposed to be. A family is supposed to be a shelter, a place where a child can depend on for help, whether in terms of physical help, whether it is emotional help, spiritual help. You're supposed to be a cover. So it's wrong to send a child out to go and look for money to buy drugs. And they need these drugs to survive. It's just like you needing air every day to breathe. So they need it. It's the responsibilities on the parent to look for money and buy those drugs, the folic acid, the paludrin that they need daily. The parents should try. I know the country is not it's now a bit difficult and all that, but the onus is on the parents to go and look for means, whether by walking or even if it means doing menial jobs, to get the money to buy the drugs. It's not the responsibility of these kids to go and look for money and buy the drugs. They also need to be fed well. So the parents, apart from buying the drug, should ensure that the kids have good food to eat. It's wrong. It's totally wrong. To become a specialist, that means you are trained particularly for that particular situation, or for that particular, depending on whether you are a pediatrician or whether you are a surgeon, you are an orthopedic surgeon, for that particular specialty. So a pediatrician takes care of children because of their peculiarities. Many people think that children are mini adults. They are not. They are a special group of people, and so they need special care. To have an adult take care of a child, that means the adult will treat the child like an adult, and that will not go well with the child, because most times when giving care and treatment to children, we have to take into account their age, their weight, and some other things, which for adults, you might just give a blanket statement and say, okay, for any adult that needs ampiclox, just give him 500 milligrams. But for us, a 3-year-old, the weight of a 3-year-old will determine the amount of drug that you're going to give the child. For children that come in with infectious disease, you have an infectious specialist that will see them. Children that come in with sickle cell disease, they have hematologists that will see them. Children that will come in with neurological problems, that's brain problems, because they are trained in that line. So for somebody that will spend 5-6 years being trained on a particular thing, you can't compare that person with somebody that sees generally adults and not that particular case. If the person is treating a child with sickle cell disease, maybe he has seen just one child or 10 children in a month. A specialist will have seen hundreds, And so we'll have done a lot of research, and we'll have come up with concrete evidence to say, for a child with this disease, this is the way to treat the child. So having a pediatrician treat children for various ailments is the best thing that will happen to children, because the pediatrician is well trained to handle issues like that.